One of the most important things I want to tell you in this video: regular veterinarian tests are in midwifery. What to do to make it work better? What if a cow doesn't forget to leave the veterinarian? Why do we do these tests? What are the benefits for all of us? In this video, I'll tell you that you see the cows that have been dumped on our maternity bed or has been involved in septic metritis and uterine infections and or any other reason within 10 days of giving birth. Now, it's possible. The vet comes to golf for 3 days, maybe 7 days, maybe 10 days in this open. Once a week in large flocks when the Gospel of Psalms is a test of the gospel to the test. What are the advantages for us? One is if the veterinarian golf is testing, he's testing a few things. Uterine massage that he does if the livestock is involved in septic metritis or infection. Mercy or both. The second point is if he takes the collar of the cow and announces the necessary treatment, gastrointestinal problems with fecal type or metabolically livestock. The vet, there's got to be a lot of a look. It's easy to figure out and diagnose it that the doctor's attorney can do in the first 10 days as a good patient finder for your pack in the big flocks. Well then. Third, when we see the scale of feces, acidosis problems with the baby's displacement. There are metabolic problems in the herd except for uterine problems, and the next issue if the livestock is any of the most important things we can do. Uterine adhesion problem is happening or anything else in the herd, it's happening right there as fast as possible. If you need to get the door open or start hormone therapy so that the uterus collects early or other problems. Trapped faster than his own body weight, haven't lost the ranch and the BC, and the body conditioning of the score dome hasn't fallen off sooner, and that's a well-known one. It's a great benefit, and on the other hand, and when we get the treatment on time, well, Dom's going to respond to the treatment sooner, and it'll be a very good result. So 10 days after the birth is a very important time period. Tell me no. We have high vet test intervals. Well, to find out if our livestock is sick after 10 days of delivery, the best time is 24 hours after childbirth. Once a day, you can do a very simple fever if you have a trap of 1/2 degree. Consult the veterinarian as soon as the fever has risen to 1 degree. Start the treatment. That would be a good thing. So our next test is the veterinarian's purity test of the uterus, which means around 28 to 35 days after childbirth. We're going to perform a test to look at the uterus through a uterine scan. We'll check my uterine lumen. If there's a particular problem, it's adhesive, or the uterus is endometriosis and the lumen of the uterus has infections, well, we'll carry out the necessary treatment there. There are special genes that may not need uterine injection at all with hormone therapy or PJ. We collect the uterus and there's no need for any antibiotics to be consumed in the uterus at all. Let me say something in parentheses, of course. I'm sure that no other vet does this anymore and it's completely outdated. Over 20 and several years old, this work has been deprecated. Some people after childbirth wrongly put boluses or tablets inside the uterus, whether for retained placenta or not retained placenta. Don't do it at all. The uterus is just a place for calves and nothing else. Sperm and calves shouldn't go in there. We shouldn't put any other thing and uterine boluses in it. This is wrong and totally causes irritation to the uterine wall, and it's not right to do this. I just said this for you in parentheses, density or our purity test. So our next step is an ovarian test. These are 3 routines I'm talking about. I promise, if someone fully follows these steps, they will not regret it. they will definitely benefit. So what is an ovarian test? It involves treating the cow to induce heat. Now I'll perform an ovarian test. This means we're getting the cow ready for breeding. I'll explain when we do this in a video. In this video, I'll show you when we inseminate the cow. If you haven't seen that video yet, go see it. I'll leave a link for you. Definitely check out that video. Find out when we perform artificial insemination in different seasons. Based on our flock's peak reproductive records, we determine the timing of insemination. I won't go into detail here. About 45 days after calving, we'll perform an ovarian test. What benefit does the farmer get from this test? If the cow continues to have uterine infections despite treatment, there might still be a uterine infection and endometritis. In this case, we'd administer another treatment, or there could be a second problem like cysts. Animals aren't static, ovaries aren't active if the livestock's condition isn't good. This is regulated with hormone therapy. Timely treatment by a veterinarian helps to steer the process in the right direction. This leads to optimal conception, and pregnancy happens at the right time. Essentially, this only works as an effective means when conditions are correct and you have prepared the cow for heat based on the hormone cycle of the livestock. There are various methods that veterinarians have at their disposal to prepare the cow for heat and various livestock cycles. Artificial insemination usually works smoothly and is typically most successful during the first attempt. If there's a herd, it indicates that things are going well. The uterus has been timely collected and the ovary is accurately placed along its own cycle. Well, this is the second issue of the third case where a vet is using sonography. What is its significant usage? What's the most impactful improvement over these 17, 18 years since sonography was introduced and implemented in Iran? The work being done is remarkable. The best thing is that we previously conducted the first test around the 40, 45, 50-day mark. Now you can do it around 28 to 30 days. You can calculate the age using sonography and make assumptions earlier in a herd. You'll realize a month earlier that your cow is not pregnant because the goal of sonography is exactly that. Once we realize that our cow is not pregnant, we can begin the correct treatment sooner. We can start the medical procedures quickly and bring the cow into yielding state quicker and make her pregnant sooner. So sonography holds significant potential and is in our hands. We can't comprehend that under normal conditions, our cow's gestation period is reduced to 35, 40 days. Is it pregnant or not? The start of fetal death, we don't understand it at all. Only with sonography can we understand. The heart beating and see the fetus's existence, we can understand, or other issues too that sonography helps us a lot with, which is a very strong diagnostic aid and it can help us. The next issue is about a bunch of things. We have fetal death or early fetal death that we have when we test for pregnancy. We will be able to confirm the pregnancy in 30 days, maybe 20 days, 15 days, 10 the next day. A very small percentage, under 5%, 3 to 5% in the herd. We're seeing some of the we diagnosed with pregnancy coming back. Fetal death for any reason because the food is variously problematic. Viruses that are in the herd right now. They can give us the death of the fetus, of course. That cow needs to have a test confirmation when around 50. 60 days, 70 days confirmation of the sonography test that we will, it's a matter of being safe. Our fetus is pregnant with our cows and our fetus is alive. And second, let's find out if we can leave in 3 or 4 months. And the cow would have died if it wasn't aged or if the embryo died. We lost a 3-month process and now we want to. Bringing the cow back in and trying to get pregnant, and that's really no seed at all. The rancher will be completely harmed and he'll have to feed me this cow. It needs to be dried up sooner, so we'll do a test confirmation and hopefully secure to test 4 to 4.5 months and test for 7 months. Why do we have 4.5 months of mummified cows or breast implantation occurs between 3 months and around 5 months? 3.5 to 5 months, if we could be in 101 cow, doesn't happen in 500 cows. But the same cow may cause a heavy loss to the rancher and the mummification. Or the mummy of the embryo is in place and is placed in the form of a dry mummy. That's where we have to figure out that in the 4 months, 4.5 months are the best. Time to diagnose mummy is a 7-month test that will safely feed the cow. I hope this video is for you, useful, and if you like to send to your friends, like, do a very important thing. We are going to make these videos because our experts are our experts. They are very familiar with these things, but these are all things. What more do we know in our society, our animal husbandry community, and the scientific level of our rancher? It makes it easier to do better, and the rancher believes in infertility and their livestock. I'll be getting pregnant later, they'll be losing a lot of money, and a video I'll be recording later, whether a trap will come later for calving every day or later in the abyss. I hope it's useful for your friends. Thank you, thank you, thank you very much. Good luck.